Hello, I'm Dr. Tahsin Neduvanchery, Consultant Interventional Cardiologist at Aster MIMS Kottakkal, Malappuram, Kerala, India. Today we are discussing about prostate artery embolization. This procedure is done for the treatment of benign prostatic hyperplasia. That means there is a swelling or enlargement of the prostate gland which is situated below the urinary bladder before the urethra. So the urethra, that is the tube which goes from the bladder to the out, passes through the prostate gland in males. As the age advances, and men after 40 years, and they develop this growth of this gland which causes compression of the urethra so that the urine cannot pass from the bladder to the outside. So this is very common. It affects 50% of men at the age of 50 years and 80% of men at the age of 80 years. So it's so common. And what are the symptoms? It produces difficulty in urination in the form of, one, the patient have poor stream of urination. It is a broken stream. Second, it is incomplete evacuation. It leads to incomplete evacuation so that there is a lot of urine remaining in the bladder, so that the patient has to urinate very frequently, especially during night. He has to get up for urination. Third thing, they cannot hold the urine for a long time. If they have this feeling of urination, they have the urgency to urinate. And fourth one, they have something called hesitancy. It is when they going to the toilet, they have to wait for the urine to come. And fifth one, there is something called dribbling. That is, instead of a stream, it dribbles, the urine dribbles, and even after urination there will be dribbling which wets the undergarments. So these are the common symptoms, and also the recurrent urinary infection. These are the common symptoms of prostate enlargement which is happening in older males. If this is happening, the treatment is, most of the patients will be given medicines. If the medicines are failing, then they have to undergo some surgery, something called a transurethral resection of surgery, prostate. And now there is a new treatment modality which is coming up, which is called prostate artery embolization. In this one, what we are doing is, we are cutting off this blood supply to the prostate, so that the prostate does not have the blood supply. It shrinks and reduces in size, and the patient gets a relief from the symptoms. So how it is done? It is done through an incision in the groin, and tube is passed until the prostate gland, and an injection is given. What are the advantages? It has got definite advantages. One, it's a daycare procedure. There is no need for admission. Second, no need for anesthesia. And third, there is no bleeding, no sutures, no wound, no scar. So this has got very lot of advantages compared to surgery, and it is very safe also. So in the coming years, this will be the treatment of choice for those patients who are suffering from benign prostatic hyperplasia or the prostate enlargement. Thank you for listening.